My name is Dr. Steph Trust. I'm the Clinical Director at Wunan Health. I'm a Gidja Walmajarri woman living on Mirrawong land in Kununurra in the Kimberleys, and at the moment we're in beautiful Walmajarri country in Mildura.
Fantastic. Now you began life as an Aboriginal health worker. What's been your career pathway from there?
So I started work, did the sort of old enrolled nursing training, which was hospital based, but then very quickly converted that to Aboriginal health worker training, and worked as an Aboriginal health worker in many different positions for about 10 years, and then started looking at medicine. And then after that time decided to go down to Perth to do medicine. So completed my degree at the University of Western Australia and then came back up as a trainee GP to the north, back home, which is what I always knew I wanted to do, and now I'm back home working in that space.
So what then, as a doctor, brings you to an allied health conference?
I think it's really there should be lots of cross-pollination between different, professions. I think there's a lot, allied health is really important in our, in a multidisciplinary team. I think if we're trying to really holistically look at care, it makes sense that allied health is a big part of that and should be. And so for me, it's a natural thing to do, that you would actually absolutely have allied health as part of your team and grow that, and that's our plan at the centre.
And you talked a bit about that with sort of a case study about a mum and a child who came in. Can you sort of talk to that, why it's important to be able to have that multidisciplinary team?
Yeah, and I think we've got multidisciplinary teams in health, but the other thing, at Wunan, at the foundation at Wunan, we have pillars that are around education, employment, housing, so those social determinants of health. And I think what we're trying to do there is to be able to make that much more seamless. So, if a young mum's coming in with an unwell child, the child has a speech issue, but also potentially issues going on at home about being able to pay bills and just cost of living, that you're able to see that young person, maybe talk to them from a health perspective, link them in with with speech therapy, but also be able to support mum to be able to go to child and parent centres, also potentially get some financial counselling to be able to look at that family as a whole, because children are not one, they're part of a family, and so how do we support the family as a whole?
So that sounds like quite an incredible holistic approach there. Has it been easy to put together?
No, it's interesting because Wunan's a foundation that started initially probably doing a lot of the social determinants of health, and then around 2012 they bought a private practice. So we're a non-for-profit ACO, so Aboriginal owned health service, and we deliver services to the whole community, and we feel that we are, have the expertise to be able to do that.
Yeah, you made the point in your presentation that you're not just experts in Aboriginal health and wellbeing, but in mainstream as well.
Yeah, I think we have a lot of knowledge in rural remote health, and I think what we have to add to the conversation, improving health in those spaces, is huge, and I think it's underutilised. And so really important for us to have a voice in spaces of health, regardless of, purely in that rural remote space, because of the knowledge we hold and we bring to the conversation.
And is that welcoming community?
Yeah, absolutely. I think a lot of our communities really want that. And you see pockets of that. We've seen some presentations today that organisations are doing that around the country. And I think so there is a groundswell of organisations doing that. And I think really it's something that's important to be discussed and highlighted.
If you could talk to the minister, any one of the number of ministers who run across this entire field, what do you need? What do you need to get things stronger, better in rural and remote health?
I think really it's looking at things quite holistically as well. A lot of people talk about funding, and funding is definitely important. But you also need system changes, and there's a whole multitude of things. So it's always a bit difficult to answer those questions because there's a lot of things that we do need to think about and talk about. I guess what I would say is that, you know, ministers having a good understanding of the communities they're talking about and listening to the community, because communities have answers, and I think that's one of the big things is we don't listen to communities and families enough. And for us as organisations to figure out how do we work with that and then empower people in the places they live.
Fantastic. Any other messages you'd like to make?
Not really. I guess, you know, really what the nice thing about hearing some of this is around the talk around strengths-based, the importance of, you know, that cultural understanding and learning when you're talking about health is really critically important, and something that's often not quite taught in sort of some of our Western health models.
Can you give an example of where that really causes issues, where you've seen it be so much better when it's strengths-based?
So really, I guess it's looking at how when we're getting young, so for example, if we're getting health professionals into our region, how do we support those professionals that might have come from Melbourne or Sydney, not lived in Kununurra before? How do we strengthen them to be able to understand that knowing ways of doing in the ground? You know, today I talked about a word called lian, which is a really important word for Kimberley people, about you know, that inner knowledge and that inner self that every single one of us have, and then being able to tap into that to be able to, one, keep yourself well, but then also be able to deliver your work well, and being able to understand that the person sitting across from you, there are things that they're going to need to keep them well. So it's that basic human connection, I think, that's really important, that starts there, and if it starts there with goodwill and openness and understanding, then it can only be a good thing.
Fantastic, Steph. Thank you very much. I'll let you go and get your jumper now. It's so cold here, 35 degrees. Thank you.
Thank you.